Hi, Matt. How are you?
I'm good. How are you, Dr. Ivy?
I'm good. So, I see here that you have an appointment for a skin check.
Yes.
Can you please go ahead and confirm your last name for me?
ASMR.
Okay. And your date of birth?
June 2nd, 89.
Okay, perfect. Are there any specific concerns that you would like to address today?
I noticed that I'm getting some moles.
Okay.
In the last few months. First, this was just one over here on the chest, and then one here in the back. But I just want to make sure that they don't look concerning.
Okay. So you have some new moles. Have you gone to the beach or sun tanned at all?
Yes, about 3 months ago.
3 months. Did you notice that before, after?
After.
Okay. When did you notice them for the first time?
Maybe a few weeks after coming back from the beach. Okay. And the last one I noticed here on the chest was about a few days ago.
Okay. Do you ever use sunscreen?
I do.
Regularly?
Yes.
Every day? While you were sun tanning, did you reapply every couple hours?
Yes.
Yeah. Okay. How's your diet? Would you say you eat pretty healthy? Yeah.
Yes.
Okay, very good. So I'm going to be focusing on your upper body. I'll check your arms, your chest, your face, and then we'll do your back as well.
Okay.
Okay, if there's anything that seems suspicious, we'll take a biopsy and then send that to the lab for testing.
Okay.
Otherwise, we'll just make sure that everything's in order. Okay? So, putting on my gloves before we get started. Okay. So first I'm just taking a general look. Yeah, you can just relax, close your eyes, whatever is more comfortable for you. Notice a little bit of irritation on this area. Your arms look in good shape, just at first glance. I do not notice anything that sticks out to me. Okay. Is this a new mole that you noticed recently?
Yes.
Okay. I'm just looking here. This arm also looks in very good shape. I do notice a few skin marks that I want to look at closer. Okay. Very good. Okay, yeah, first glance there's nothing too concerning, but we're still gonna be doing a very detailed examination. I do notice a little bit of a skin growth in this area. Have you had this for a long time?
Yeah, for many, many years.
Okay. we'll be taking a closer look at this. Okay. So I'm starting to take a look here at your face. First, I'm going to focus on the area along your hairline here. Okay. I do not notice any irritation along your hairline, no moles, no skin marks. There is a tiny what seems to be like a little inflamed follicle in this area. Does this hurt?
No.
Okay. That should really go away on its own. So I'm not concerned about that. Okay, would you be able to turn this way? How do you usually part your hair?
Sometimes in the middle, sometimes on the right side.
Because it's very common to see a little bit more tanned the area where we usually part the hair. So since it's more exposed to the UV rays of the sun, we want to make sure there's nothing along your part that would be concerning. Do you have any skin type concerns on your face? Do you struggle with dry skin or oily skin?
Dry skin. Yes.
What's your skincare routine like?
I usually wash my face with a cloth and warm water, and then I apply face cream for hydration.
Okay.
That really helps if I do it morning and night, but sometimes I forget.
Okay. Take a closer look with my magnifying glass here. Okay. Just looking here along your part. Everything's looking good. Do you have any history of eczema or psoriasis? No. Okay, that's very good. Do you have any allergies that you know of?
No.
Okay, very good. Okay. So your hairline looks very healthy. I am taking a closer look at this follicle that seems to be inflamed. Yeah, that should clear out on its own. And if it's not painful, it will eventually get absorbed back into the skin. Very good. Just gonna walk here behind you. Make sure there's nothing on this side. Okay. Everything seems normal on this side as well. Okay. Now I'm going to move on to your face. I'm going to be checking for any moles or skin marks that look concerning. Okay. There's a tiny mole in this area. Very small. It's not raised from the skin at all, so it's a really good sign. You have a little bit of sun spots on your skin, but that's pretty normal. None of them look to be inflamed. The skin around your lips is a little bit dry, which is normal in this type of weather. There's a little bit of a pore that seems to be inflamed, but nothing concerning. Do you ever exfoliate your face?
No.
Have you had this mole on your nose for a long time?
Yes.
Okay. It is a little bit raised from the skin, but there is no lesion around it. Doesn't seem to be inflamed. pores around your nose seem to be in very good shape. I do not notice a lot of blackheads or a lot of acne or nothing like that, which sometimes it's common to find around the nose. Okay. Yeah, your skin on the cheeks is a little bit dry. You can see there's a little bit of flakiness to it, but not too concerning. I can definitely recommend some face creams that are going to help with that. Be able to turn your face a little bit this way. Perfect. So, this area around your forehead is a little bit oily, which is very common as well. So I would definitely say you have a combination of dry and oily skin. But other than that, there's not a lot of moles that I'm concerned about. Have you had this mole here since you remember?
Yes.
Okay. Okay, definitely looks very normal. It is raised from the skin, but very uniform in color. I do want to go ahead and measure this one and the one on the tip of your nose, just to have that on file. So this one here is 3.5 millimeters by 2. Okay, turn this way. This one here is 3 millimeters by 4. So we have a 3 by 4 and 3.5 by 2 millimeters. Okay. Okay, now I'm gonna move on to your right arm.
Okay.
Okay, so moving on to your arm. Start with your hand here. Okay, I don't see any skin marks. Capillary refill is normal. There are no moles on your hands at all. Your nails look healthy. Do you get them done very frequently?
Once a month.
This is definitely a little bit raised from the skin. Taking a closer look at it. Doesn't seem to be inflamed. It's pretty uniform in color. So looks very normal. Okay. There's nothing on this side. You rest your arm like that. Perfect. So this area, I'm taking a look at the new moles that you mentioned. I am definitely gonna measure those since you mentioned that you hadn't noticed them before, but just looking at them, I'm not really concerned. They are very uniform in color. They're not raised from the skin at all. Okay. So moving on to this other one. It's a little bit raised from the skin, but it's pretty uniform in color. It really does not seem concerning. I am going to take a measurement of the ones that you hadn't seen before, just to make sure. This one is 1 millimeter by 0.5 millimeters, and this one is 1.2 millimeters by 1 millimeter. Okay, I'm gonna move on to the other arm. Okay, so just taking a first look at this arm. See a couple of moles that are a bit raised from the skin. You have a couple of scars in this area. Had you noticed them? Have you had these for a long time?
For a couple of years, I think.
Do you know what happened?
I don't remember.
It looks like maybe it was a burn from a flat iron or something.
That sounds like something I would do, yeah. I sometimes burn the sides when I take something out from the oven or just cooking.
Yeah. Okay, so there's one mole here. I'll get raised from the skin. It's pretty uniform in color. Okay, so I definitely want to take a measurement of this one. But other than that, everything else looks very normal here. You have another scar here on your arm. Is that from a vaccine?
Yes.
Okay. Okay. So I'm going to go ahead and measure this one. That is 3 millimeters by 2. Okay. Everything else here looks very good, very normal. So far, I'm not really concerned about any of these. There is no need to do any biopsies. Okay. Go ahead and do your abdomen now. Check your skin. Okay, now I'm going to take a look at the skin on your abdomen. I'm going to lift up the top a little bit. Is that okay? I'm just going to go ahead and move this down a little bit. Okay, very good. Are you comfortable? Yeah. Okay, so I do notice a big scar here right now. It looks like it has some raised scar tissue. Seems to be about maybe a year old. Is that right? Yeah. Okay. I would recommend that you always make sure you have sunscreen on it, because they can really get even darker with the sun. Okay. And this side, there's a couple more moles and skin marks. Nothing concerning. Just going here, making sure that none of these are raised. Okay. Okay. Take a closer look here with this magnifying glass. Okay. Very good. Okay. Your belly button seems to be very normal. No lesions, no irritation. So that's very good. Okay. Just gonna go ahead and listen. Okay, everything seems to be very normal. Just making sure I don't feel any masses or lumps. I'm going to be palpating and pressing lightly. Is there any pain?
No.
I'll be pressing a little bit harder. Just let me know if there's any pain. I do feel a little bit of a tender area over here. Does this hurt?
A little bit, yeah.
This? A little bit?
Yeah.
How about here?
No. No.
Okay. Does it hurt when I press?
No.
Okay. Okay, I'm just comparing here to the other side. Is there any pain here?
No.
If I tap?
No.
Okay. Okay, very good. Okay, so I know I'm looking just at the scan, but I did notice a little bit of inflammation on your abdomen, and it would be a good idea to send you to the lab to get some blood tests done just to make sure that your liver is in good shape. So I would recommend that you go and get those done. Other than that, I really don't have any concerns with your moles. I know you notice these that are new, but I measure them, and I'm gonna keep that in file. I do want to do a follow-up in 3 months and just see how if they've changed or in size or color, and then we can go from there. Okay? Do you have any other concerns or questions?
No, thank you.
Okay. Well, it was very nice seeing you. You can make your appointment for 3 months in the front desk. Okay?
Okay.
Thanks.
Thank you.